Hello, how are you? My name is Dr. Algernon Prelo. I'm a second-year family medicine resident at Meritus Medical Center.
Hi, I'm Kezia Ellison. I'm also a second-year resident at Meritus Medical Center in Family Medicine.
Hi everyone, thanks for joining us. My name is Tomi Sariki. I am one of the first-year residents here at Meritus Medical Center Family Medicine.
And hi, I'm Olaoye Jagede. I'm one of the second-year residents in the family medicine program at Meritus Hospital.
We are reaching out to you today to answer any questions that you may have about the COVID-19 virus and also the vaccine. There's a nationwide effort to get as many people vaccinated so we can get back to some semblance of normalcy in our country. And we're addressing vaccine hesitancy, and we want to just open a dialogue with you to answer any questions that you may have.
You want to give us some stats?
Okay. So we'll start off with some stats. Here in Washington County, Maryland, about 21,000 people have been vaccinated so far. Of that, 16,000 have received their first dose, and about 5,000 have received their second dose. Presently, about 9.5% of COVID tests are coming back positive in our county, and statewide it's about 4.5%. It seems that over much of this pandemic, Washington County has been running about twice the state average of positivity.
Okay. And we wouldn't ask the public to take a vaccine that we haven't taken ourselves. So I would like to invite Dr. Sariki to share her experience getting the vaccine.
Sure. Like Dr. Jagede said, I have received both vaxes of the Pfizer vaccine. Overall, I had a very pleasant experience, to be completely honest. I typically do feel a bit feverish after getting the flu shot every year, but this time with the COVID vaccine, with my first dose, I received it in my left arm. I had a pretty good amount of left arm soreness about 6 to 10 hours after getting the vaccine. Not that I couldn't use the arm at all. I was able to use it, move around, drive, write, and all those good things. But it definitely had a level of soreness that was a little bit worse than the flu. And I had a little bit of fatigue, but nothing debilitating. I was able to go about my daily tasks and get stuff done. So that was the extent of dose 1 for me. And then about 4 weeks later, I got the second dose. And with the second dose, I got it in the same arm. And I honestly had a little bit of arm tenderness, not anything compared to the first dose. And that was really it. Overall, I couldn't have been more pleased with my vaccine experience. And I do urge all of you to get out there and receive your vaccine, both doses, when the opportunity does present.
Thank you. Would you like to add anything to
Sure.
that?
Well, we wear our stickers proudly as far as having been vaccinated. It really is both an honor to have had the vaccine. One, it allows us to be able to serve you better, knowing that we have initial level of protection. So my experience with the vaccine was similar. Symptoms can be a little worse for people after the second dose. And that really makes sense, and we can talk about that if people have questions, just as far as how your immune system works. So,
Okay. So we have compiled a few questions that people typically ask about the vaccine, and we'd like to run through those here, and then we'll take questions from you if you require any more clarifications or want to know anything else about COVID and or the vaccine. I guess the first question here is, why should anyone get the vaccine?
Yeah, we hear that question a lot. The vaccination does two things. One, it'll help establish herd immunity. That phrase has been tossed around a lot. Basically, we need 70 to 80% of the population to get vaccinated, so COVID can calm down some. Also, until herd immunity is established, the vaccine will help prevent you from getting a severe case of COVID-19. So people who are vaccinated, if you do come in contact with the COVID virus and you get sick, you would get a less severe case or a mild case. And the vaccine has been shown to be very effective at preventing people from, one, requiring hospitalization, and two, developing a severe case of COVID-19.
Thank you. So we usually get a couple of questions about how the COVID-19 vaccine works, and I'd like to answer that. So in our bodies, we have mechanisms designed to protect us from infection. And the way that our body expresses itself, the way that our DNA expresses itself, is through proteins. So the COVID vaccine is pretty much a set of instructions to our body's internal mechanism to produce proteins that will fight against the COVID-19 virus. We were able to do this through a worldwide effort in such a short time because it's a virus. It's a simpler organism than bacteria, for example, and we were able to sequence the proteins on the border, on the wall of the virus. So doing that and having so many people together working in concert and in parallel enabled us to kind of not rush, but go fast, quickly through the vaccine development process, where many of those processes that would have been done one after the other in a little siloed laboratory were being done simultaneously throughout the world. And that's why the vaccine was able to be produced so quickly. People also ask what other types of vaccines exist. In the past, what we've done is to use dead, inactivated, or even partial parts of pathogens to introduce them to the body so that the body can produce a response to those materials, such that when we did then come into contact with the actual pathogen in the wild, the body will be like, oh, I've seen you before, and I know exactly what to do to combat you. Okay?
So just to clarify, Dr. Jegede, the process for creating the vaccine was expedited,
Yes.
right? Because this was the main point of concern, so we had a lot of hands on deck
Exactly.
to expedite the process. And do you have concerns that the quality of the vaccine given how quickly it was developed?
Oh no, I have no concerns about the quality of the vaccine. The technology that was used to create this vaccine is something that we luckily had, already worked upon, and it was just waiting for the right circumstance to be employed.
Right.
And again, even though it's COVID-19, that's why we have that little, appellation there saying 19. Coronaviruses have been known to humans for a long time. For example, if you have a dog, they get the coronavirus vaccine. I think that's every 2 or 3 years.
Mm-hmm.
So, but this was a special mutation, of that vaccine. So we were able to quickly identify what was different about it, and then make a vaccine that will protect us from those differences and from that COVID-19 infection.
Great, yeah, and that's what I was going to add is, again, the science is not new. It's just we were able to put the vaccine together quickly, and I think you explained that very well, because oftentimes when you hear the news, we don't have the same time to explain the details and go through things, but there are scientists who've been working on these viruses, not just coronavirus, but many other viruses, for a very long time for this exact type of moment.
Yeah.
Mhm.
And coronavirus, too, is a common virus that causes a cold. So, we've known and we've studied these even in our own educational training for our careers, and we know that coronavirus, like he said, is not new, but it's very well known to those in the medical field and medical practice to cause a common cold.
But like COVID-19 is the variant that we've been having trouble with that's
Correct.
caused this really difficult infection for the entire world to cope with, really. Does anyone want to talk about side effects of the vaccine? Do you want to talk about that?
Sure. So, kind of like any vaccine, people react differently. Various vaccines, to various viruses. I know we've all probably heard of the different effects and impact the virus itself has had on certain individuals. And the vaccine kind of does the same. So like I kind of explained earlier, for me, the side effects were quite minimal. I had some arm soreness, maybe a little bit of fatigue, and that was really it. But there are a lot of people too that are having side effects that are a little bit more severe, and most of those side effects tend to develop about 12 hours or so after the initial vaccine. Well, mostly after the second dose. They receive the second dose typically. They develop these symptoms, and they typically last for about 24 hours. And some of the symptoms that people are telling us about are high fever, chills, body aches, a lot of sweating. I don't know if there are any other symptoms that you guys have heard about, but those are the ones that I know that I've heard from patients and family and friends alike. And that's the extent of it pretty much.
Right, and what I like to tell patients is all of those responses mean that your immune system is working. So it doesn't feel good, we don't like those symptoms, but the whole point, as Dr. Jegede shared, is that we have exposure to the virus so that our body can fight it, and that's literally what we're feeling. The fever, the chills, all of those symptoms mean that we're having a proper response to the vaccine. Now, those people who don't have symptoms, it doesn't mean that their body's not working, because again, we're all different, we're all individuals, and we respond to things differently. But for those with more severe symptoms, they may just have a very strong immune response, and that's okay, which is why we monitor people for the first 15, 30 minutes after you received your vaccine to make sure that there are not more severe reactions.
Correct. Yeah.
And it is recommended that you do not take Tylenol prior to receiving your vaccine, because you should want to experience some of the side effects to see how your body is responding. But then that also serves another purpose. You can serve as an ambassador to your family, friends, coworkers, and share what your experiences with the vaccine are, so that they will know what to expect when they get vaccinated as well.
I just would like to address part of the reason I was running. We work in family medicine, we train in all areas. I have a particular interest in women's health and labor and delivery, so some people may be asking about the vaccine in pregnant and breastfeeding women. So I will start with kind of what we already know, as far as we recommend that pregnant women get the flu vaccine, right, to protect themselves as well as their babies, because although pregnancy is a normal process, it is a process that can compromise your body and your immune system, so you want to build it up. So just as like we tell you to have the best nutrition you can, we want you to also protect yourself with vaccines. Unfortunately, we don't study things in the same way in pregnant women and children for obvious reasons. However, because again, this vaccine is tested, it is prepared similarly, we know that it is safe for pregnant and breastfeeding mothers who choose to take the vaccine. Now, again, this is a conversation that you have with your doctor, your provider. But in general, if we tell you that the flu vaccine is recommended for you, then the COVID vaccine would also be recommended for you. That's the general way to think of it.
And it's also recommended in pregnant women because it's not a live vaccine, right? There's no live COVID-19 virus in the vaccine. So the likelihood of the vaccine compromising the mom or the baby is extremely low, and that's why we're confident that it's in the best interest of the mom and the baby for mom to get the vaccine.
Thank you.
And the Pfizer vaccine, actually, when they were doing clinical trials for it, they did not enroll pregnant women, but subsequently, approximately, I think it was 20 women found out that they were pregnant and did receive the vaccine, and there were no complications with their pregnancies. And of those 20, I do believe majority have decided to breastfeed their babies after the babies were born. So it's a decision you have to make for yourself and with the assistance of your primary care doctor. But that is something that has been studied. They're studying and following.
Now, I have a question. Has any one of you, this is going back to the issue of side effects regarding the vaccine. Has any one of you heard of anybody here in Meritus Medical Center or in Washington County who has been to the emergency department following, receiving the COVID-19 vaccine?
Not to my knowledge, no.
Okay. And are there certain age groups that is the vaccine restricted to any age groups?
No, the vaccine is like all age groups should receive the vaccine.
Yes.
There are prioritizing certain
Yeah.
certain age groups so that as vaccine becomes available, it's easier to provide it.
Yeah,
Yeah.
that's what I completely
So
agree.
because we have a limited supply, because we're trying, this is an extraordinary endeavor, really, that, we will look back and say, these are really groundbreaking times. We're trying to vaccinate the entire population of the country and, of the world at large, so we have to roll it out in phases, and that's why it's been decided that those people who are extremely vulnerable, for example, our population over the age of 65, they've gotten priority as well.
There was a question about people with autoimmune conditions, pre-diabetes.
Yeah.
Go ahead.
So, there's a question about people with autoimmune conditions having, pre-existing medical issues like diabetes. Would you like to answer that, Dr. Curley?
Patients with pre-existing diagnoses such as these should get the vaccine. They put COVID-19 makes diseases like diabetes, high blood pressure, it makes it worse. So you need to get a vaccine as soon as it's made available to you. The only caveat that I've come across so far is patients that are on chemo. If you are temporarily on chemo, you should wait until after you've completed chemotherapy to receive your vaccine.
Yep.
If you're on an indeterminate chemo or you don't have an end date, you should go ahead and get the vaccine to provide you as much protection as possible.
Yeah, I mean, and I like to share too, I have people close to me who are cancer survivors, who, recently have battled cancer, are currently on even immunosuppressant drugs and have received the vaccine and are doing very well. They didn't experience any side effects outside of the ones that we've spoken about already here today. And to be honest, have had quite pleasant experiences with the vaccine. So if that is a concern for anyone out there with autoimmune issues or have, on immunosuppressants, please, 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 we encourage you to do get the vaccine when you're able to.
Another question that comes up is, oh, hey, you know what? I already got COVID. Why do I need to get the vaccine? What do you guys have to say about that?
Well, if you're unfortunate to have already had COVID and you have recovered, I'm glad you recovered. Your body has developed antibodies to the COVID virus. Those antibodies will protect you for about 90 days. But outside of 90 days, you're not guaranteed to still have coverage. So after anyone who's recovered from COVID, the CDC now recommends that you get vaccinated 28 days after you have recovered so that you can have lasting immunity to and protection from COVID-19. And as far as children, right now, no one under the age of 18 is recommended to get vaccinated. However, the Pfizer vaccine is doing clinical trials for ages 12 to 17, and the Moderna vaccine, they are studying age 6 to 17. And those results should be in the next couple months. So hopefully children, if it's safe, children will be able to get vaccinated soon, hopefully.
And then last question that I had written down here is, people ask, once I get the vaccine, do I really need to put the face mask on? What am I doing with this if I've already gotten the vaccine?
Very good question. Well, this is why we're all sitting here, even though we work together and have been vaccinated with masks. One is the possibility, as I use influenza as an example. If you're vaccinated, you may have already had the virus in your system, and we may not get sick, but we may spread the virus to other people, which we definitely don't want. So those of you who are vaccinated, we still ask that you wear face masks when you're in public, social distance, keep a good hand hygiene, all of those usual things, so that we are able to keep the infection rates down. You can think of it as once you have been, I think we talked about like the 30-day period after your second vaccination, people that you are in close contact with at home, you can, decrease using masks and what have you. But again, still when you go out in public, we recommend that you still do these precautions of masking.
I've been asked a lot whether masks actually work, and having worked in the emergency room last month, the other physicians and I were noticing that we're not seeing flu cases this year. The only thing different between this year and last year is that people are wearing masks and washing their hands more frequently. So if you're not certain whether all this social distancing, hand hygiene, and mask wearing works, look around. Do you know anybody that's had the flu this year? This is the peak of flu, normally would be the peak of flu season, and we're not seeing any cases.
Same thing for the children. RSV cases tend to be up around this time as well, and we don't have any children, very few children have been admitted to my knowledge at the hospital for it as well. So.
Now, do we have any questions from our viewing public?
Most of them you've answered.
Okay. So it seems like we've covered most of the questions that the people currently online with us right now have been asking. Thank you very much for your questions. This video will be available to view after this live session is over. And if you go ahead and have any further questions, you can put them in the comment section. Somebody will respond to them as soon as we can. And also, Dr. Ellison, could you share that website with us?
Yes, meritushealth.com/COVID vaccine gives you information on how to get vaccinated in Washington County. So we recommend that you check that out. If you don't have access, hopefully we're working on different ways for people who don't have internet access to get more information, but hopefully someone can share that with you. So meritushealth.com/COVID vaccine.
And if you have any additional questions, we have been conducting outreach events, and on this Saturday from 11 to 4 p.m. we will be at the Valley Mall outside of Belk to answer any questions that you might have. And you can sign up to receive the COVID vaccine there as well.
So thank you. We hope this session has been informative for you. Again, my name is Dr. Jagade.
I'm Dr. Sariki.
Dr. Prelo.
Dr. Ellison.
And we're from Meritus Family Medicine. We're members of the residency program. And we wish you all the best.
Yeah, stay safe.
Thank you.